So we'll start by going over some of the features of the dynamic scope and explain how it works. On the left side we have a water bottle and flushing system. This system ensures that the scope is cleaned of any mucus during the examination. Beneath that we have a recording system which records the image to a USB thumb drive so we can review the video. On the right we have the video processor and the light source to create the image. And the scope itself has some unique features. It is semi-rigid and can be twisted and bent into a fixed position. This is possible as the scope does not have any fibre optic cables. When the scope is in position we can make some fine adjustments using this wheel. And there is a tiny camera and light source on the end of the scope, and here with the scope plugged in we can demonstrate how the light source illuminates the inside of the airway. And here we're demonstrating how the flushing system clears the end of the scope of mucus. This is the noseband we use to attach the scope to the horse. It's got some clips and we can attach the scope to the clips. And the final piece of equipment is a remote video screen to help us place the scope. So here we are attaching the scope to the horse. We place the saddle pad which holds the equipment beneath the saddle. Then we fit the modified noseband and then we are ready to place the scope. The jockey makes for a useful Teletubby to help us ensure the scope is placed correctly. And then we fix the scope inside the clips using cable ties. As you can see, the horse tolerates the scope very well, which is very important because we are trying to replicate the racing conditions as closely as possible. So we bring the horse out to the track and just follow its normal routine. Today we want to do a bit of fast work, so we warm the horse up. This horse did about 3 laps of the trotting ring first, and then we went out onto the gallop for a piece of fast work. The amount of work we do depends on if the horse is a sprinter or a stayer, but we generally on average work over about 1,000 metres. But when the horse gets up to maximal exercise it can be quite difficult for the jockey to hear noise from the horse's back due to the wind. From the ground, if you listen, we can hear the noise quite clearly. Another method to dynamic scope a horse is to place it on a treadmill. The advantage of a treadmill is that we can see the image live and change the work accordingly. The disadvantage is that the treadmill less accurately replicates racing conditions. Here we can see that this horse had a dorsal displacement of the soft palate. Other common dynamic conditions include recurrent laryngeal neuropathy, otherwise known as a roarer. This still image demonstrates how much of the airway is obliterated during maximal exercise, leading to a huge reduction in airflow and performance. Some conditions are easier seen when we slow the video down and look at it frame by frame, such as this case of dorsal pharyngeal collapse. The dynamic scope helps us to get a more definitive diagnosis so that we can choose the most appropriate treatment and help us to get a better outcome.